Women's Health Week is the second week in May, and I wanted to jump on this topic with Faye McCray about the challenges women face when seeking care and the importance of preventative care and early detection. Faye, she's the Vice President and Head of Healthy Equity and Social Impact of Healthgrades. Thanks for hopping on the line, Faye. Before we get to some of the statistics, I'd like to get you to give our audience an overview of what you do and the purpose of Healthgrades.
Yeah, so Healthgrades is one of the number one ways for provider search so that folks can look for doctors and physicians. And we conducted a study recently revealing that while women are the primary healthcare managers for their families, handling everything from appointment scheduling to caring for sick family members, we tend to put our own healthcare needs on the back burner.
You know, I was thinking when I was looking at some of these statistics, I was thinking, what did you guys do? Do you guys have like a camera in my house? Because I think you're pretty much talking to me. Tell us about the survey in terms of the statistics of what you found.
Yeah, so our study found that women are often skipping their own preventative care. So 65% of all women reported they delayed or skipped a healthcare screening, treatment, or procedure in the last year. So you're definitely not alone. And you know, the leading cause of delayed or canceled appointments has been cost concerns. So 1 in 3 women say that high out-of-pocket expenses are a top reason that they've delayed, avoided, or even skipped medical care, while only 1 in 5 men list cost as a reason for delaying care. Other common reasons women skip care are convenience factors, like forgetting to schedule or finding options inconvenient. And once they decide to seek care, women face obstacles as well. So Healthgrades ask women what factors they consider most important when it comes to being satisfied with a primary care doctor. And the number one criteria for women's satisfaction with a primary care doctor is whether that doctor listens to them.
And yeah, I really fall into this category. We prioritize our kids, we prioritize our family members over ourselves when it comes to health care. We're just spread thin. So how do you suggest healthcare providers market to us?
Yeah, I mean, we absolutely are spread thin, and we're absolutely, taking care of everyone and putting those needs above our own. And I think the first step really into addressing that is to just make it easy on us, integrating things like online appointment scheduling or even just sending reminders to women when they're due for screenings or when you have an appointment coming up, make it infinitely easier to be compliant with preventative care. And I'd say also just making cost information more transparent, speaking to those cost concerns. We want autonomy, we want affordability. So point women towards resources that can help defray the cost, like prescription discounts. I think most women will agree, especially when it comes to your children or people that you love, you tend to be more than willing to kind of spend the money on their care, but we don't do the same for ourselves. So just making that cost information more transparent makes it more attainable to prioritize your care.
Mm-hmm. And I'm sure that the COVID pandemic probably did not help our attitude toward making appointments. Talk to us about that.
Yeah, women's confidence in going to the doctor has returned to nearly pre-pandemic levels. But our study found that, over half of women are still skipping that necessary preventative care, particularly in the last year. So, fortunately, we found that nearly half of women are taking their health more seriously than before the pandemic. So in that regard, doctors and healthcare systems kind of have an open window or an opportunity to engage women and motivate them to prioritize their own health care.
Okay, now tell us how you found that race and gender play a factor in the decisions we make looking for a physician.
Yeah, so our study didn't specifically indicate a preference, but there are so many studies that show that satisfaction and outcomes improve when a doctor shares your gender, race, or ethnicity. But women were more likely to report that when they had a doctor that was also a woman, they trusted them more. So gender did play a role.
I was looking through your website, and you said at the beginning of our conversation that you help people find a physician, pretty much. So walk us through when someone goes to your website, how they can utilize your services.
Yeah, so our team spent, countless amount of time just making sure that folks can have a real personalized and curated experience when, engaging in provider search on Healthgrades. So when you go to the website, the first thing you can do is put in your zip code so that you can find matches that, match you geographically. But then also you're able to search by specialty area, which is great because, even from when you're looking for a primary care provider to a specialist, it's all there and available. And a great tool in our site is our reviews. So we feature patient reviews in star form. We also have written reviews. So you can really determine whether or not a doctor is compatible with you. So again, to that point about listening, that bedside manner, you can see what other patients have experienced with the doctors that you're looking at. But again, also that experience with specific conditions or procedures that matter within the specialty area that you're looking in. And lastly, we help our users be able to search by high-quality hospitals. So you can determine whether or not a doctor is affiliated with a high-quality hospital system. So Healthgrades makes it easy to find all of that information in one place.
Right. And with Women's Health Week, it's great to highlight these things. And ladies, we can do better. We really can do better. Faye McCray, she, again, is president and head of health equity and social impact of Healthgrades. Where can people get more information about what we've talked about?
Yeah, they can come visit us at healthgrades.com to learn a little bit more about the study, but also to get started on their journey. Again, it's the perfect time for you to give yourself the gift of self-care, whether or not it's a Mother's Day present or just in honor of Women's Health Week. So you can come visit us at healthgrades.com.
Absolutely. Faye, thank you so much. We appreciate you.
Oh, thank you for having us.